Carol, and I will be giving you tips along the way to help you learn to flush your central line.
Hi, I'm Patty, and I'm an oncology nurse. Today we're going to be talking about flushing your central venous catheter. Either you or someone you love has a catheter that needs to be flushed in your home. So today we're going to be talking about the 10 steps of caring for your catheter. Washing your hands is probably the most important step of taking care of your central line. This prevents infection. If you don't have running water and soap, then you can use an alcohol-based hand sanitizer that has at least 60% alcohol to clean your hands.
Wet your hands with clean, running water, warm or cold, and apply soap. Rub your hands together to make a lather and scrub them well. Be sure to scrub the backs of your hands, between your fingers, and under your nails. Continue rubbing your hands for at least 15 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. Rinse your hands well under running water. Dry your hands using a clean towel or air dry them.
Make sure you have a clean, flat surface to work on when you're going to flush a catheter.
This decreases germs on the surface that could get in or on your central line.
Next, we're going to assemble our equipment, and we use a central line dressing kit that has everything in it that you need and your flush. We're going to first open our dressing change kit. Make sure you don't touch the inside of it. It opens so that the paper part is in the back and everything is stacked to what you need. And the first thing we're going to put on is our mask. We're going to take the mask, put the elastic around the ears, pull it down over your chin, and pinch the nose. Next, we're going to put our sterile field out. You're going to try and pick it up without touching anything but the edges. And lay it out on your clean surface. This gives you a place to work and put your equipment. The next thing is we're going to open our syringe, not touching the syringe, and lay it out on our sterile field. You want to examine your syringe before you use it. This one has cloudy fluid in it, and you would look at the expiration date. We would not use this syringe. This syringe is nice and clear. It has 10 milliliters in it, and we look at the expiration date before we used it.
Look for air bubbles. Tiny bubbles are okay, but push any big bubbles out to prevent them from going into your line.
Next, we're going to put our sterile gloves on. It's important not to touch them. Open up the package. Lay them out. Grab them by the cuff. Try not to touch the outside of them, and slide your hand into the glove. These might be a little bit tight in the kit. That's okay. Next, using this gloved hand that is clean, you're going to pick up the other glove and slide your other hand into it. Now, we're going to clean our end cap. You have 2 alcohol wipes that you want to put on your sterile field. And we want to scrub the hub of this end cap. You're going to use a strong, firm pressure on the end cap. Next, we're going to connect the syringe. We're going to take off the end and connect the syringe to the end cap. So we're going to unclamp the catheter, and you're just going to open the clamp. Now we're going to flush the catheter. And it's important that you use a push-pause method. And this helps to increase turbulence in the line to clean out the inside of the line so it doesn't clot.
This helps to keep the line patent or free from obstructions that could delay or stop your infusion treatment.
Make sure you do not bottom out the syringe into the bottom here, because that could cause some air to go into your line. Next, we're going to disconnect the syringe. Just twist and pull it off.
A bubble of fluid on the max plus end cap is normal when you remove the syringe. Wipe it off with the alcohol pad.
Lastly, we're going to clamp the catheter back up.
Problems? Call your health professional for redness, drainage, odor around the line or on the dressing, or a fever of 100.4 or greater.
Sometimes the catheter gets plugged, so you're not able to instill fluid into the catheter. When that happens, what you can do is change positions, raise your arm up, cough, or bear down a little bit, and possibly the catheter can move inside of you. If not, you need to not flush and call your health professional.
Let's do a quick recap. Step 1, hand washing. Step 2, assemble equipment. Step 3, set up equipment. Step 4, sterile gloves. Step 5, scrub end cap. Step 6, connect syringe. Step 7, unclamp catheter. Step 8, flush. Step 9, disconnect syringe. Step 10, reclamp catheter.